Well, welcome everyone. Thank you so much for joining us today for this virtual conversation on an extremely important topic of children's mental health. I'm Rob Cashel, President and CEO of Family and Children's Agency, and we are truly delighted to be hosting this conversation with a distinguished panel of experts who'll be introduced shortly. I want to first thank in advance our panelists for giving us their time and their expertise today. I really appreciate that. So a couple of words about FCA. As many of you know, Family and Children's Agency is one of the largest nonprofit human service organizations here in this area. Our services include licensed mental health and substance abuse services, foster care, adoption services. We run an after-school program, parenting education and family support, and we also provide services to seniors and the homeless. All of our services are strength-based and outcome-focused, and we're all about focusing on strengthening the lives of those in the communities that we serve. This year, we're entering our 80th year of serving the greater Norwalk community. And since 1942, we have actually touched the lives of literally hundreds of thousands of individuals and families. So we are delighted to be hosting this today. Certainly one of the things we have seen in our services that focus on the challenges of families and children is the impact of the last 2 years on children as it relates to mental health. So this topic could not be more relevant, and I am delighted that you will have a chance to hear from the experts that you're going to hear from. I'd like to now introduce our wonderful facilitator for today's event, our own Chief of Community Services here in Norwalk, who will tell you a little bit more about the program and introduce our panel of experts. Lamond.
Thank you so much, Rob. We're just working on a few technical difficulties, but I can imagine all of us have experienced that in many ways here and now. And today I've been knighted as the one with the technical problems. So please bear with us, but I believe we're gonna have an amazing conversation during this lunch hour here in the East Coast. I've been informed that this is one of the largest gatherings around this topic, which really lets us know that we need to continue to talk about how we as a community, as a collective, as practitioners, as colleagues, and just as a country, help our children. And that's what today's topic is about. I'm aware that we have representation from many of the states. And so if you're on the East Coast, good morning. If you're in the Midwest, maybe mid-morning, afternoon. But what's important is that you have decided to take an hour out of your schedule and join us today. So let me just say a few things and we're going to get going. I do have a few prepared remarks that I would like to share to kind of set the context and the stage. So, you know, without question, the pandemic has impacted us all. And we as practitioners, we have seen the severity of the impact as it relates to trauma and mental health, specifically with our little ones. I am a proud father of a 7-year-old and 1-year-old son. And we had our son during COVID, and there's this new term, oh, is that a COVID baby? Because we had a baby during COVID, and my wife, we were in that morning, but here's the change that we're all trying to figure out. We're going to talk about that. We delivered that morning, and that night we were home. That's a wow right there. That's a wow. And we delivered that morning, and they said, you're going to have to go home because we don't want to keep you in the hospital. And so I say that to say, from a child perspective, this is their world too. This is their community too. And I was impacted when they had to shut down our schools and we all had to figure out how to parent at home, and saw from the first hand what my daughter was struggling with. But I'm excited today because I'm going to moderate and you're going to hear from some amazing experts. We have an esteemed panel that's going to talk about this. So what we're going to do is have a conversation with our esteemed panel. And then at the latter part of today's conversation, we want to engage you. So in the chat box, ask some questions. They'll feed me the questions because we also want to respond to what you're thinking and from the perspective you're coming from. I also want to highlight, if you are a parent or a caretaker, thank you. If you are a practitioner, thank you. If you are a decision maker, policy maker, thank you. So let me begin by saying thank my panel for joining me today. So what we're going to do, I'm going to invite the panel to respond to a question, but before they do that, I'll ask them to introduce themselves, and then I'll ask a question directly to them. We'll do a quick round robin, and then we're going to have a conversation, and then we're going to say, those that are joining us, what do you have to say? And we're going to do our very best to respond. So I'm excited because she's not a stranger to me. I've had an opportunity to be on panels and moderate, and that is none other than our great commissioner here in the state of Connecticut, Commissioner Vannessa Dorantes, who is our Department of Children and Families Commissioner. So Commissioner, welcome. So good to see you as always. So can you talk a little about yourself? And then I'm going to ask you a question.
Absolutely, Lamond. Thank you so much for including DCF's voice in this conversation. I am elated to be here during our second big forum. You know, you can tell by the number of attendees that this is definitely a topic that the citizens of Connecticut are interested in hearing, and we're just excited to be a part of that dialogue. So I'm Vannessa Dorantes, the Commissioner of the Connecticut Department of Children and Families, and I'm glad to be a part of this esteemed panel. Did you mute on me, Lamond? I can't hear you.
You know what? That always happens. And I'm like, oh. So let's get to it. So thank you, Commissioner. So Commissioner, you've heard what I said at the top. I can only imagine from where you sit. Can you just talk about the perspective of how you see, you know, how we're responding? What are we doing? What are you thinking? You're a decision maker, a policy maker. You are setting the path for our state. What's on your mind as we talk about children's mental health and the impact that we're seeing around anxiety, depression that Margarita and Patty is going to talk about? We're seeing suicide ideation rise. So what are you thinking from where you sit, Commissioner?
Thanks, Lamond, and thank you to the city of Norwalk for hosting this forum, along with Family and Children's Agency, who is a wonderful partner to the department. You know, DCF hasn't closed. And so throughout the last 22 months, we have worked side by side with our community partners to make sure that the kids and families of Connecticut have gotten what they need. But make no mistake, this has impacted everyone, every facet of our lives, every facet of our normalcy. And when we think about when there's this prolonged period of toxic stress, we have to tune into the needs of our kids. So what you'll hear today is, you know, really reflecting on the lightest touch to the deepest end of needs for kids and their mental health. Everybody knows DCF's child protection mandate, but we are also statutorily obligated to be part of the thinking system around children's behavioral health in Connecticut. And we are working alongside our sister state agencies, community partners, legislative partners to make sure the kids and families of Connecticut have what they need as it relates to therapeutic interventions in our wonderful service array. But make no mistake, this has been tremendously taxing on all families.
Thank you, Commissioner. I can imagine, Commissioner, you know, we're still learning. I mean, we've never been here before. I know I've been saying this is a new era, a new time. So, you know, in terms of what are you learning in terms of where are those pivots and shifts that we should be thinking about? And how do we
the benefits of one of the benefits of being in a state like Connecticut is that we are relatively small geographically, So we can kind of pivot and be nimble really, really quickly. And what we have learned is that we have stretched beyond the capacity. We, the collective we, the over 260 people on this call, have pivoted and stretched collectively to link arms with each other to really try to figure out, are there basic needs that need to be met? Are there community conversations that we need to stoke? Are there services that we need to lift up or enhance? All of those different facets and components of being responsive and working together, I think, have just been exacerbated in a positive way as we kind of step through this, what we call an imperfect storm of COVID-19, racial unrest, and economic devastation. All of those things, you know, kind of converging all at once has really, you know, taken us for a loop. And as you've indicated, there's not a playbook for this. We've kind of taken what we know as subject matter experts across all the disciplines to try to figure out what's around the next corner. And some of that can't be predicted.
Absolutely. Thank you so much, Commissioner. Looking forward to joining in the conversation in phase 2 of the discussion. So I'm going to welcome and invite Dr. Margarita Munoz. We're so excited to have you here. She is the medical director of behavioral health for FCA, the host agency for this presentation. So can you tell our listeners, our viewers, a little bit about yourself, Dr. Munoz?
Hi. First of all, it's my pleasure to be here today with such a distinguished panel. As you mentioned, I am medical director of FCA, but also Family Centers in Stamford. I am overjoyed to have joined these two wonderful not-for-profits that have been a part of the community. Prior to this, I was vice chair of the Department of Psychiatry at Bridgeport Hospital, which is part of the Yale New Haven system, and medical director of their intensive outpatient program, which serves children, adolescents, and adults as well. And before that, I spent 20 years as medical director of the largest non-for-profit for mental health in Westchester County, New York, WJCS. And I trained at Columbia University and served chief there. My focus has always been on serving underserved community mental health populations.
Awesome, thank you. And I want to put a pin in that underserved communities because Dr. and Patti and Commissioner, I want to get back to that. So I saw a quote from the National Council President and CEO, Chuck Ngoglia, and he said this, Margarita, the mark of the COVID-19 pandemic has gone beyond physical health. It has negatively affected children and adolescents during a crucial time for social and emotional development. So can you talk about, based on what he said, you know, what are you seeing and what are you experiencing in your work as it relates to this statement?
Well, I think definitely we were in a mental health crisis even prior to the pandemic because we are seeing a rise even prior to the pandemic in suicidality, even in affluent communities, particularly in the younger age set. Girls 10 and up have almost a twofold increase in suicidal ideation and attempts. So that was preceding the pandemic. The pandemic, as we all know, has created another sort of crisis, a loss of connection and isolation, as well as economic stress and parental stress. And we know that parental stress trickles down to children as well. So when you treat a child, you treat the community as well because you're addressing issues with the parent and the school system. So what I've seen in the last 2 years is a dramatic increase in the acuity. And by acuity, I mean the severity of illness that the children are presenting to. So they're not getting the assistance at the earlier stages where you could do a little bit more of the preventative work. I think initially during the pandemic, that was related to a lot of fear. People were afraid to seek out care. We're sort of more homebound. And then the other factors of being remote, parents working remote, trying to juggle those situations, children losing their sense of community by not having access to school. So we see an increased need for mental health needs that are on the rise. And I see that a lot of people here are in the field, and I know that the demands and the needs are really taking a toll on staff as well. And that the gift that you give the community by providing these services is really key. And I know the state works tremendously to try to increase these needs as well. I come from a strong background in New York State, and I have to tell you that I am so impressed by the blessings that we have in Connecticut of 211 and ICAPS in home services, which are not available in most states. So although there are waits and there are increasing demands, we have some incredible resources.
That's great. We certainly do. Thank you for that. And we'll be joining a great conversation. Patti, good afternoon. Patti Nietsch is an LCSW clinician here at FCA in the behavioral health. Patti, can you tell our viewers a little bit about you, and then we'll ask a question to you as well.
Thank you, Lamond. As I'm an outpatient behavioral clinician at Family and Children's Agency, where I've been for 8 years. And it's what I do is on a weekly basis, I meet with children, adolescents, their parents, sometimes grandparents, and we deal with some of the things that have derailed them and try to get them back on track. And it's, as the commissioner said, it's not just about the children and the adolescents, it's also about the families and the communities. It's so much of a system, a structure that has to be dealt with. I'm also trained in trauma treatment. I was trained at Columbia University, and I also did a year-long collaborative with DCF about 10 years ago. And it's, sometimes we think of trauma as just being like a sexual assault or interpersonal violence, but for a child, it can be a divorce that they think that they caused. It can be a severe dog bite. It can be, for an adolescent, it can be that phone call that an extended family member has committed suicide. Those are all things that, we take in and we work with, it's the clients who really do the work, and we guide them to try to get them back on track.
Thank you so much, Pat. I think one of the takeaways, I hope our viewers, that most certainly these are trying times, but we cannot do this alone. Having our commissioner from the state perspective, having Margarita from, a psychiatric, developmental perspective, and then Patti, on the front lines with treatment, and so is our Margarita. So I want to bring you into the conversation from this perspective, Patti. Providers such as yourself, and I know your colleagues are listening, so they want to hear what you're doing, how you're treating, during these trying times. But here's the question, Patti. Providers such as yourself are quickly adapting. I think that's a good word too. We have to be adaptable, flexible, and got to just figure it out to meet these emerging needs of children and adolescents. So Patti, what are you seeing? What emerging needs are you seeing in children, adolescents? And then what would you suggest? And you could answer that to me in two folds, both to your colleagues, other clinicians, and then I want to highlight, there may be parents and caretakers that are listening. So two-part, what are you seeing and what are you doing, and what would you say to your colleagues, the practitioners, and then parents who are saying, I just don't know what to do?
Well, there's so much to be, said. This COVID has put such an umbrella of stress on everyone. It's just been unbelievable. Our agency has did an amazing job of pivoting to virtual when everyone got shut down, and then we've come out of that. And last couple of weeks we had to go back to virtual as well. But it's the issue is really connection. There's been a lack of connection as people have become so isolated from friends, isolated from their church communities, isolated from other community organizations, with school shutdowns, isolated from their teachers and their counselors and their peers. It's really been a tough 2 years for everyone. So you know what, I always, when clients come to me, I try to teach them skills to deal with this stress and this added stress. And I do have my bag of tricks that that I can recommend. Of course, we do a thorough assessment and find out what the story is. Sometimes it's not always what's initially presented to us, but one of the things that I would suggest for parents and for caregivers is to create a sanctuary at home as much as you can. Come home and have dinner. If you can't do it every night, maybe even once a week, have dinner together. Put those devices in a basket for an hour. Just leave them aside, because that's also been a huge source of problems, especially with our young people. If they have TikTok, get them off of it any way you can. There's been a lot of, a growing amount of research about how bad that can be. But one of the things is to just talk to each other and have fun. And I know that sometimes that sounds like, oh, Patti, our families are so chaotic, they can't possibly do that. Even if they sit down and eat for 10 minutes and put those devices away, that's a start once a week. So often as adults will come home and say, oh, it's such a bad day at work, I need to have a drink, and I need to have that glass of wine. Well, instead of saying that, maybe say to your kids, oh, it's such a bad day at work, I'm going to go in the other room and meditate for a few minutes. Anybody want to join me? Or I'm going to go for a walk around the block for 10 minutes. Anybody want to come with me? And you're sending such a better message to that. So I also, one little thing I brought with me is bubbles. You can get one of these for $1 at the dollar store. And when kids are dysregulated, pull out the bubbles, get them to breathe in, blow out the bubbles, and you're going to just be a start in helping them to breathe and to be able to deal with some of the incredible stresses we have.
Oh, I love that. Practical. I was just saying, I'm going to use that. So we're going to have a conversation, then they're going to let me know when we're going to take some questions. But I think I told the panel, sometimes I do go off script because something triggered when you were talking, Dr. Munoz, and then I want to hit back to the stigma, Commissioner. What struck me is when you said that we were already in the mental health crisis pre-COVID. One thing I'm learning, new words are also being emerged from what's happening. So, and then open up to Commissioner Patti. You may want to speak to this too, but I'll start with you, Dr. Munoz. What makes this different though? Can you unpack that for us? Give us some language. So trauma, anxiety, depression, but the pandemic hit. Help us understand, but what makes this different? Can you speak to that?
Well, I think we can all speak to Omicron's impact in our sense of hope and seeing an end. So what the pandemic's created is a sense of uncertainty, right? We don't know when it'll end. We don't know when our normal will return or if a new normal will return. So kids thrive on structure and consistency, as do adults lots of times. So when you lose that sense of, when we had the chicken pox as kids, although kids don't get that anymore, you knew like you were going to be sick for a week and then you go back to school and life would be normal. So it's that sense of uncertainty really that has shaken people. And the waves are very difficult to deal with emotionally as well. So we're dealing with an era where a lot of technology plays a role, like Instagram and self-image. There's comparison. You know, not every family can afford an iPhone or an Android. So there's a lot of pressure to keep up with technology and a lot of pressure from kids to conform to what society says. And that is from a body image issue, as well as an ethnic and cultural issue too, to conform to what the standards are believed, and I'll put standards in quotations. So that's what we were dealing with before. So children these days have a lot of stress and pressure, and it starts at a much earlier age. Kids now are really concerned about the environment and, you know, longevity and loss. So having the pandemic, it's created an increased sense of uncertainty, but it's also taken their normal life out of context. In that, you know, I just look at last year, and I do group therapy with kids. I was doing that last year. And sometimes we had to shut down if the spike would come up. And so the consistency wasn't there. And the uncertainty is there. And a lot of kids, I can't tell you how many kids I've treated who have lost a grandparent or a teacher or someone who was important to their life. And so there's this stress of fear of impending doom happening. So they're living under that pressure, and accessibility to certain resources aren't available in the same way. Resources are still available. So a normal depression or anxiety may be augmented in quite a way. Wonderfully, a lot of organizations have been really creative in utilizing technology for good rather than for bad. But I think to speak to parents, keeping the sense of structure and normalcy in their child's lives is really key. You know, if faith was important to you and was a sense of, gave you a sense of opportunity, you know, continue that in some way or other, even if you can't physically get out there. Look for other resources that are available. And I know that's going to be a topic for discussion, but I think it's that sense of uncertainty that has really increased anxiety and depression.
That was great. Thank you. Thank you. Commissioner, you know, we'll segue right into that and couple it with, you know, stigma. I mean, you and I've talked about it on different platforms. So, you know, how do we promote? I have this saying, help is not a bad word, but communities, you know, culturally, it could be a lot of things. So, you know, what would you say to that? I mean, this is going to live beyond today. Someone may pick it up and hear something and may say, you know what? So can you talk about, you know, stigma, how, and, you know, any strategies or resources the state is promoting? And then can you also talk about it from a cultural perspective?
Absolutely. You know, the universality of this makes the stigma piece that much more important for us to dispel. You know, listening and talking to each other, making sure that parents and families know where the resources are. Something as simple as what Patti just shared in terms of the bubbles and, you know, sharing our resources and ideas across disciplines. I see in the chat that there are some school social workers here. There are some, you know, community-based workers here and people with lived expertise on how to navigate and be resilient. I think collectively, if we continue to share what has been helpful for the kids and families and communities that we serve, the stigma of mental health treatment can be decreased. I don't know if it'll ever be eliminated. We all would hope that to be, but I do think that, you know, because everybody has been challenged with their normal coping skills and coping mechanisms have really been tested, that, you know, the status quo has not gotten us through this. This has just been something that all of us and all families and communities have had to grapple with in their own ways. But I think that the one thing that the vaccine and more understanding of the pandemic itself has taught us is that we, even in isolation, don't need to be alone. recognizing the power of the connection between each other. And it's a blessing and a curse. We just heard from the clinicians about the impact of technology, but, recognizing how you can stay connected when we feel isolated. From the lightest touch to the deepest end, our service array here in Connecticut is pretty robust, yet we still are looking to pivot and add more to behavioral health services, whether it's to address specific groups of kids with unique needs, or whether it's to build up parental capacity to understand what their kids are going through, or to give additional tools in the toolbox to our providers. All of us have to look at the entire system to know how to be able to navigate the hopefully the end of this pandemic and beyond.
That's awesome. Thanks, Commissioner. Patti, and I'm going to invite you to Margarita into this. When should, or what does it look like where, parents, loved ones, family members, that there's a concern? What would precipitate that we as practitioners would probably encourage to seek out some help? Can you start talking about that, Patti? Then Dr. Munoz, I definitely would like you to add to it, but we'll start with you, Patti.
So when something is concerning is when it's beginning to impact the functioning. If a child refuses to go to school, if there's child is very irritable, like not just adolescent irritability, but like over the top irritability, or yelling or screaming, or having just fighting with friends, or whatever it is. It's when it becomes over the top. That's when it can always help to have call someone and get an assessment, find out what's going on. Oftentimes, I think a barrier to parents is they think that if they go to counseling, it means that their kid is going to be put on medication. I hear that a lot, and that's not necessarily the case. Medication is one tool. At FCA, we use it very conservatively, but it's and that's always a parent's decision. It's that's something to think about, but it can never hurt to get a consultation with someone in the mental health field who's trained to help.
Thanks for that, Patti. And Dr. Munoz, I just want to make a quick comment going back to the commissioner. I think it goes back to, like you said, Commissioner, that, will it ever go away? I don't know, but, I'm just reminded from one of our conversations on one of the panel before round, to Patti, to your point, doesn't mean you're crazy. I think we need to say that, because these terms are still out there. You got to go see for help, or there's a weakness. And I think, just quickly, can you speak a little bit to the cultural piece, Commissioner, around, just from culturally, not that, I'm not suggesting that, every culture is this way, but we know, people believe that. Can you just speak to that? And then Dr. Munoz, I'll have you add to kind of what are those signs?
Absolutely. Culture, race, ethnicity, language, all of that is important to really understand the communities that we serve. There's a huge immigrant population in this portion of the state that this particular webinar is originating out of. There are families who English may not be their first language. For us as service providers, we need to meet families where they're at. Whether it's that faith-based connection that families have, or really understanding how families in particular communities access help. It's our job as the service providers to make sure that the class standards, culturally and linguistic service array, and being able to connect with people that we serve, understanding that sometimes you might have to be innovative and unique. One of the things DCF is putting forward and developing right now is an urban trauma initiative. And that's really understanding communities who have faced community violence from the clinical perspective, and building up our clinical service array to understand models that will address specific cohorts of kids. There are people in the chat that are talking about services to families with kids with disabilities. Important for us to lean into those special pockets that have not only the intersectionality between race and culture and the things that we're talking about right now, but if there are additional areas that families need us to lean into to really understand the communities that we serve. And again, know what's out there. one of the things that has been lifted up during the pandemic, along with United Way 211, is a website called connectingtocarect.org. And it's being able to have care coordinators help families understand what's available in their community across Connecticut. Again, it's connectingtocarect.org to be able to understand what it is that unique communities need across the spectrum here. We have people on today from DCF's Wilderness School. That's an outdoor adventure-based area that, you know, has a clinical component to it. So it's sometimes thinking outside of the proverbial box, but understanding that we have clinicians like the ones that are on here today that really understand how to pivot and help serve kids and families in the context of the systems that they live. But, you know, you really have to call out and be really directive as it relates to the impact of race, language, and family norms.
Fantastic, thank you. So Dr. Munoz, could you mind picking up just what are those signs, and, you know, unpack that a little bit more for us around what would then say these are concerning, you probably should talk to a professional?
Yes. Before that, I'd like to talk a little bit about the stigma, if that's okay, because I think our job on so many levels, whether it's teacher or religious organizations, the stigma of mental health is life-threatening. You know, we have suicides every day. We have overdoses every day. Education is empowerment. And as a minority myself, it is our job to be educated, because unless we're educated about mental health, we are disempowered. We need to be empowered to make the correct decisions for our community and ourselves. So education on so many levels is key. And I think it is a right for everybody, because once the communities are educated on mental health, I think that stigma will subside. You know, it is often a very biologically based illness in the brain. And once we view that once we view depression and anxiety like hypertension or asthma, we will then increase accessibility to care. But going back to your other question, I'm very passionate about it.
Great job. And then we are just want to let our viewers, we will be asking questions right after Dr. Munoz. We have some questions coming in, so we'll pose these questions to the panel.
And then so as far as knowing when it's time to seek care, really, it's a little tricky, because I'll tell you that parents and adults are very good at picking up what we call externalizing disorders. So those are disruptive behaviors, like the hyperactive kid, the kid that's always getting into trouble, you know. So those are things like ADHD or defiant behaviors, right? They're the ones that are difficult. What adults are not good at picking up are internalizing disorders like depression and anxiety. And those are really severe, and they're on the rise. So a lot of primary care facilities have implemented screening tools. One of them is the PHQ-9 or PHQ-2, which has a checklist, because kids feel more comfortable, you know, sort of doing these checklists themselves. So oftentimes parents might notice the child being more isolated or withdrawn. Maybe school refusal might be a symptom. In order to have a clinical diagnosis, there has to be a degree of impairment. So all of us, we're humans, we're all feeling people. So it's normal to have periods of depression and anxiety. When these periods become prolonged, and in children, it could be as short as 5 days or a week. When it causes impairment, that's a time to seek out help. And I know I hear from people, oh, the wait is so long to get in to see someone. Your pediatrician is actually a good source of information for an initial assessment to see what that needs. And I know we're going to be sharing some resources later on. There's some wonderful resources online that have symptom checklists that you can do, and as well as other resources. If your child or your patient already has a diagnosis of depression, anxiety, bipolar disorder, ADHD, there are also some beautiful pamphlets and brochures that I would encourage schools and clinicians to print out and have at their access on, which really create that empowerment, that education, that destigmatization, and sort of normalize it. And those are available on the National Institute of Mental Health website. They're available in Spanish as well. And the American Academy of Child and Adolescent Psychiatry. So impairment and loss of functionality, whether it's not sleeping, not going to school. And of course, if at any point someone develops thoughts of hurting themselves or thoughts of hurting someone else or erratic behavior, those are more emergent situations that require urgent help.
Lamond, can I jump on Dr. Munoz's comments related to suicidality? Because I think this topic is hugely important as we're talking about mental health and families coping and understanding the cues from their kids. The Connecticut Suicide Prevention Initiative, one word, one voice, one life, has a lot of information to be able to understand and hear from people throughout the lifespan. So little children expressing those internalized behaviors of self-harm or thoughts of self-harm all the way through the lifespan. There is a gizmo for the number 4 mentalhealth.org, which is kind of a mascot of a little dog when you're talking to younger children about their feelings of, you know, whether or not they're self-harm or having some of that ideation. That's another way to be able to tune in to some of what we are hearing of children and their internalized behavior. And I so appreciate the kind of distinction between internalizing behaviors and externalizing behaviors, but understanding all of that is stress. You know, it's all ways that kids manifest what's happening inside of them, because what we're seeing is that children are taking their cues from adults, and everybody around them are, you know, really, really stressed right now. And so to help kids navigate through this, we have to tune into them no matter how they are expressing themselves.
That's great. So there are some questions coming in, and we're going to do our best to respond. And sometimes I may just paraphrase them so that we can try to cover a little bit of things. So to the panel, and we kind of started talking about it, but want to, you know, make it, you know, more pronounced in the conversation. Can you speak to the ongoing impact on racial inequities on youth, families, and the community in general? And, you know, I think for me, when I see that, you know, we talk about referring families and individuals to resources, but sometimes they need the resources for the resources, you know, whether, you know, sliding scale pay and all that. So, you know, however it means to you, but let's put it out there. You know, we know that, you know, I don't have the data, I don't have the research, so don't charge me to it, but I know, you know, we can speak to that, you know, in our vulnerable communities, specifically our Black and Brown communities, the experiences is different, not just the ability to access, but the ability of quality services, and then so forth. And I think we can look at the data to validate some of this. So, you know, who wants to jump in and, you know, what are we thinking? What are some thoughts, and what could we do to speak to this and try to improve on this?
You know, I think for us, as we kind of continue to grapple with our data and understanding outcomes, we have to know if what we are producing is helping everyone, and, you know, really disaggregating our outcomes by race, not being afraid to talk about and question and, you know, find out where there are areas that we are falling short, particularly as public entities, to know that we're meeting the mark and meeting families where they are. You know, I think forums like this allow us to learn about what other services are in the community, so we can make sure that we can support each other and resource each other that way. But I think as we understand the impact of all of this, we would be remiss if we did not understand things through racial and cultural lenses, because we do know that families and communities experience stress differently. And so therefore the interventions have to adjust to that.
Patti or Dr. Munoz, you'd like to share anything?
Yeah, I would add to that the importance of data collection. I just read that this virus has really impacted the Latino community greatly, but on the 2020 federal census, 50% of Latinos categorize their race as other, and no one really knows what other means. So that's, these are things that have to be teased out to gather more information about exactly what's going on. And of course, the undocumented community would not be a part of that census information. So we need to gather more information about that and how this is, it's impacting that group. So data collection is so important.
So Patti, I can comment on what the other means. I'm Caribbean Latina. So, and I actually had a census person knock on my door one day and say, you have to pick, well, you look white, so you have to check off white. And I got into a huge discussion about that's not my identity, because I am a mix of African and indigenous roots and European. And that's not how I view myself. I view myself as a person of color. We should never be judged by our external appearance, because that is not how we identify. As far as the Latino population, this is a population, I'm very fortunate because I'm Puerto Rican and that's part of the United States, and we have the luxury of traveling back and forth. But a lot of the Latino population have suffered a great deal of trauma just in their ability to cross la frontera, which is, their as well as accessibility to services. But but there are a lot of services available. They just don't know about it. Family Centers has school-based programs, and they treat a very large population of Latino children in those populations. And a lot of these families aren't aware that there are some wonderful resources for the uninsured and the undocumented in this community.
Thank you for that. I know that even in my role here in the city of Norwalk, it is, I don't want to always use the word struggle, but how do we promote, excuse me, the resources that are available? But I think, I'll add that caveat around being sensitive, within a cultural lens, because how I might promote a service in one community or to one ethnic group may be very different. Because I did see in the chat around, oftentimes there is belief, and I believe there's data to support it, that, sometimes people of color get either overly diagnosed or underdiagnosed, and then that determines the treatment level. So I would put a pin in it and say that, as a former practitioner myself, that's something that we have to constantly think through in terms of how we are embracing and treating and working with families that may be very different from us, and really listen and hear how they, and I think that goes back to that self-identity, Dr. Munoz, that you eloquently raised, how they identify themselves, and even how they may speak to their own issues, and then meeting them there, and then, taking them on the journey. So that's like my little 2 cents as a moderator. Here's a question for everyone. This is a great one. The faith community, commissioner, it's a resource. And many are still saying it's an underutilized resource in our community. How do we engage them? I would also say, how do we then challenge them too? And so here's the question: how do we challenge the faith-based institutions to step up and be a stronger support to the family? Now, that's not my question, so I don't want to say I'm anti-church. That's the question that came in, but how do we bring them into the fold as a resource around, because one can argue, there's a spiritual component to helping. There's an emotional component. So What do you all have to say?
Yeah, at first I would want to say that the faith-based community is here. You know, they have shown up in community in spades, because what we know is that many communities will go to who they trust. And the faith-based community oftentimes represents that trust factor. You know, so for us that are in the formal systems, we do have to meet communities where they are. And many of our faith-based partners do just that. You know, they're in the communities. They know where people go to for help, and they don't feel as judged that way. Also, you know, we have to be intentional of seeking first to understand the families that we commit to serving and helping. It's not projecting what I think should happen. It's opening up our ears and sometimes taking a step back to hear families express to us what they need, you know, to hear parents and, you know, really validate their frustrations of what's happening, you know, to help kids express themselves sometimes when they can't do that in a way that they are typically able to do. So as formal systems, we have to continue to challenge ourselves to, you know, really be tuned in. I also included the Access Mental Health link in the chat because something that Dr. Munoz said about pediatricians and the clinical consultation available to them, being able to help from a medical aspect, understand the mental health needs of kids is also another area that we have beefed up. And, you know, there's an effort across the state to really know and find out where those gaps in services are, but to make sure that not only that we fill them, but we make sure that families know how to access them. So, you know, I see that we're going to send out a resource list after this, and that's also important that everybody on this, everybody here within this webinar, listening in the audience, take that resource list and spread it as far as possible to make sure that, you know, kids and families in Connecticut can have access to the resources that are available to them.
And I just wanted to add, you know, being active in my community is sometimes we as the practitioners or the structure, for those that are watching, we may have to knock on their doors and say, I need your help, whether it's the church, the mosque, the temple. They serve our constituents, and sometimes partner with them or bringing in faith leaders to say, listen, this is what's happening. Bring the data to them. To Commissioner's point, we have seen positive results of saying, are you aware that the data in which your church resides, this is what's happening, and really has seen positive thoughts. I want to move on because we are slowly getting to our time. And Dr. Munoz, I want to bring in the question we talked about in our planning, and that's the question about technology. And I want to read what we have. We know there's some research that has indicated that technology can have both a positive, we started talking about it, a positive and negative impact on children's mental health. I know there's research now saying that there is concerns about the impact of screen time on mental health. What would you say to those who are listening? And again, I talked about the top. I have a 7-year-old and I have a 1-year-old, and you know, I'm guilty. Get the iPad, but we also have to be careful because, you know, it's worldwide information, and a lot of stuff can happening, and then the peers, you know, someone's mad at me on TikTok, and if the child's already in a vulnerable place, Patti, that can have a very devastating impact on that individual. So Margarita, you'll start, and then Patti, if you want to add to it around, you know, technology, this is the world we live in. I'm talking to you all through a box. Take it away.
So technology, like I said, it's both a blessing and a curse. For kids, it's often part of their community, right? So I believe everything is okay on some level of moderation. So really keeping structure and limits is really key, as well as parental monitoring. So really educating parents on, and this can come from the school or providers, pediatricians also open this up for discussion as well. As to what's going on these online websites. We now know there's a major suit for Instagram because of body image issues. There's lots of data to show that, you know, sexual exposure is something that happens at a younger age due to these things. So I think it's looking for positive venues in which to get that sense of a community where there isn't free access or free reign as well. Parents, I hear from a lot of parents, oh, they lost their soccer game or they lost this. So I just let them have like their phone all the time, or I let them, go on Instagram because that's how they connect with others. But kids need rules and they need structures. And reliance on those things to create a sense of community really shouldn't be their sole purpose. Speaking with your kids frankly about what's out there on the internet, and also placing filters and limits. We know that blue light is really activating. It can disrupt sleep. Disrupted sleep can lead to a whole host of problems.
Thank you. Patty, you want maybe a couple of seconds to respond? Anything you want to add?
Yeah, if anyone hasn't seen the movie A Social Dilemma, I would really recommend that. It's about how these algorithms have taken over on social media. And there is definitely a correlation in anxiety and depression among adolescents with the onslaught of social media. So, but as Dr. Munoz says, it's not something that, it's part of their life now, it's part of their social fabric. So it's really important to limit it and talk to them about it, talk about their lives in social media. It's as important as talking to them about their friends.
And I just want to close. I see our leader here, who hosts is here, so that's an indication for me. But I want to personally thank the panel for joining and allowing me to moderate. But I want to leave us with this thought, and that's this: that we all have a role. And I think someone asked, what can faith leaders do? It's not just faith leaders; it's all of us to start talking about it. It's okay if you need help. I said at the top, help is not a bad word. Or you may need to talk to someone outside of your family to get that extra support, and that's okay too. Thank you so much. I'll turn it over to Rob, CEO and President of FCA. Back to you, Rob.
Great. Thank you, Lamond, and many thanks to our panelists. I think it's pretty obvious to everyone on this webinar. We could talk about this for the next few hours very easily, and I cannot thank all of you enough for giving us your time and your expertise today on what we know is a critical topic for the families that we work with in all the communities, not only here in Norwalk, but throughout Connecticut and frankly, throughout the country. So I can't thank you enough. A little plug for the future. These virtual conversations are something that we've instituted here at FCA beginning in the fall. This was our second one. And stay tuned and be on the lookout for another virtual conversation that we're looking to do in the next few months. And the topic that we will be focusing on is the impact of what's been going on over the last few years on the senior population. And I think we all recognize that that population is among the most vulnerable that we work with. So once again, many thanks, Vannessa, Margarita, Patti, and of course, Lamond, for all of your efforts today. And thank you all for joining us.